You're watching the Dr. Nandi Show. Thank you for being here today. Now, I'm here with Renee Vandenstock, who underwent some non-invasive cosmetic procedures in her quest to maintain a youthful appearance. Now, we're joined by Renee's surgeon, the renowned Dr. Anthony YOUN, who's known as America's holistic plastic surgeon, and he's also my good friend. Thank you. I appreciate that. Yeah, of course. Thank you so much. First of all, tell us about Renee and how you counseled her, and what had first happened to her, and how did you counsel and treat her?
So Renee was a case that we see all the time. Somebody who's excited about getting a cosmetic procedure done, they have a procedure done, and then they develop a complication that maybe they didn't expect. And so, when I saw her, I saw that the issues that she was having, and I knew that we did have an approach that may be able to help her. The problem is that you can never get a person back to where they started. So whenever you have a complication, we can try to repair it, but it's never back to 100%. So the best thing is to try to avoid having that complication in the first place.
Yeah, and one thing that Renee said was that, that she didn't expect this complication. I'm sure you see that a lot, that nobody's talking to these folks about the possible negative effects. How often does that happen?
Unfortunately, it happens a lot more than we would expect and people expect, because devices and these treatments come out and they're hyped and they're proven safe, but they may not be proven effective, or they may not be proven to have not to have problems. It may be safe, but safe means that you may not die from having it done, but you may still have complications from it.
And what did you do for her? She talked about fat grafting, is that what?
Yeah, so that's a very simple surgical procedure where we took a little bit of fat from her thighs and basically injected it in very tiny amounts in her cheeks into the areas where she had had some actual dents and scar tissue. And the great thing now is that there's stem cells in the fat. And we've learned, actually, when we did her surgery, we didn't even know it at the time, but now we know that that fat is chock full of these stem cells. And so not only can you give her that volume back that she has lost, but you can actually help even improve the skin from that.
So what happens is, when he's talking about the stem cells, they can actually rejuvenate the skin. So not only just fill it up, but you can actually make the skin look better. And so the difference, Dr. YOUN, between invasive and non-invasive procedures, and this is kind of your specialty, tell us about that.
Yeah, so that's huge. Now, the great thing now is it's a great time to be a plastic surgery patient, as weird as that may sound, because there's so many things that you can do now that don't involve surgery. We can get rid of fat non-invasively using devices. We can tighten up skin without having surgery. There's so many things that we can do that it is a very exciting time. And you know what? If you can get the look and the appearance of your skin that you want without going under the knife, by all means, let's do it that way.
And some of the stuff that we talk about that's safe, maybe give us some examples of that. I think Renee said it too, but what are some of the things that people are watching, they don't even know about this stuff? What are some of the techniques you can talk about?
Yeah, one of the coolest things we have in the office right now is called sculpture. It's fat reduction using a laser. So I've always said the holy grail of plastic surgery is, how can you lose fat without dieting, without exercising, and without even needles? And so we have these devices that will either freeze your fat, they will laser your fat, and you can literally lose 24% of the thickness of your fat after one 25-minute treatment. Wow. Now, it's not an excuse for not being healthy. It's not an excuse for letting your weight get out of control. It really is best for people who are at healthy body weights, who just have those stubborn areas of fat that maybe their mom or dad gave them, and no matter what they do, they can't get rid of them.
And here's the thing, we're not advocating go out there and get all these procedures done. It's not the point. But if you're thinking about it, we want to give you some choices. And Dr. YOUN, the wonderful thing about him is that he never recommends procedures unless he feels like you need it. And he's talked many people out of doing these procedures. And so who should have this stuff done? Like, who should have these? And you talk about the healthy weight, but who really should have it done? People come in and say, I want to look even better, or I saw this picture on Instagram. That's not really it, is it?
No, I mean, it really comes down to, number one, if you want to look your best, you need to be healthy. So follow the things that you recommend to your patients, that your experts recommend. Get on the right diet, the right skincare, and you can use these types of procedures and these treatments as an accessory, okay? And I always recommend surgery should always be the last resort. If somebody asks me, Dr. YOUN, I'm thinking about having a surgery, what's the worst thing that can happen to me? I tell them, you can die. That's the worst thing. Okay,
right.
And you're unlikely to die.
That's a big side effect.
But you can die from having surgery, and so we always want to use that as the absolute last resort.
Yeah, and that's, see, not everybody says that, and that's why we love having Dr. YOUN here, because he says those things and it's real. And again, people still can have it done safely, but you need to know, all those things that can happen and the complications that Renee wasn't told. Renee, how do you feel today, and compared to before when you had the complications?
I mean, I feel great now because, there's so many many non-invasive things that you can do to try to correct those things. Not even surgery is really necessary nowadays for fat loss. You can do, you know, hyaluronic acid fillers in the face to try to plump up the skin, and Botox to help with movements that, you know, where you get fine lines. So I feel great. I'm really happy, and I think conservative is definitely the way to go too. You don't want to overdo it either. So
That's awesome. We'll take a quick break. When we come back, Dr. Youn is going to stick around and we'll talk more about plastic surgery options, and he's going to give you some tips for looking good. Stay with us.